lecture on sedatives. I'll be introducing some substances and class of substances within this category and talking a bit about their medical uses in this mini lecture. So we'll first begin by talking about barbiturates. These are considered the traditional downers in terms of substance use and misuse. They're administered orally through pill form or intramuscularly or intravenously. And they're very potent depressants on the central nervous system. And we've actually talked about a depressant before when we talked about alcohol. Barbiturates are another type of central nervous system depressant. Alcohol is probably historically the most popular and most commonly used depressant. But barbiturates had their kind of heyday in the 50s and 60s in terms of recreational use. And so they're not used currently as street drugs very much. They're extremely potent, very sedating. The person may experience some sense of euphoria, but otherwise is really just going to kind of fall asleep. They have a high rate of death due to the central nervous system depression, the respiratory depression, and they're used a lot in medical settings, actually, in order to capitalize on that sedating effect. And when they're used in surgery, a breathing tube is necessary in order to facilitate respiration, which it would otherwise be shut down by these substances. So they're used to sedate someone during while general anesthesia is being administered. They're used to medically induce a coma in a patient, and then they're also prescribed to be taken to help with convulsions in seizure disorders. So they really just down regulate the central nervous system. And because of this, they're very dangerous, and they were ultimately largely replaced by benzodiazepines, which I'll talk about in a moment. That's true in terms of people who use these substances recreationally. The medical uses of barbiturates are still valid and are still being used. But if a benzodiazepine can be used instead, it often is. Barbiturates are identified by the endings pental and barbital. So if you see a substance with those endings, it's likely a barbiturate. And there's 4 examples here with their street names. So fentobarbital is something used in surgery. It's called phenos. Secobarbital, red devils, amobarbital, blue heavens or blues. Often it's related to the color of the pill. And pentobarbital is called yellow jacket. So this is what people refer to them as in the 60s, 50s and 60s when barbiturates were more commonly used recreationally. Benzodiazepines, aka benzos, these were developed in the 50s as a safer alternative to barbiturates. So they had a more selective depressant effect on the central nervous system so that you could get the experience of sedation and anti-anxiety effects without suppressing other essential functions of the central nervous system as much as barbiturates would depress them. Benzos are now some of the most commonly prescribed, used, and abused prescription drugs, and they can be taken in the same way as barbiturates, orally, intramuscularly, or intravenously. These substances are identified by the endings azepam or azalam, and there's a variety here. Diazepam is also called Valium. This is a long-acting benzodiazepine. And benzodiazepines are often categorized by the half-life, so whether or not they have a longer or shorter half-life. So you'll hear me reference that as well. Lorazepam is also called Ativan. That's a short-acting benzo. Alprazolam is Xanax. That's a short-acting one. Midazolam is also called Verse. It's a very short-acting benzo. Clonazepam, also called Klonopin, is more long-acting. And flunitrazepam is also called Rohypnol, which is more longer acting. The most addictive, the reason the half-life is important, and we've talked about this before, is it has an impact on how addictive these substances are. So the most addictive are Xanax and Ativan, which have a very short duration of action relative to other benzos, so about 4 hours. And that means that they enter the system more rapidly and they're metabolized more rapidly, so they leave the system more rapidly. And so they kick in quickly and they dissipate quickly. And so users are ending up watching the clock, kind of looking for when they can get their next hit of this sedative. Less addictive would be Valium and Klonopin, which have a longer duration of action, about 8 hours. So those substances pack less of a punch in terms of the effects that the user feels, and they're eliminated from the system more slowly. So the person isn't ready for the next dose as quickly as for the more short-acting benzodiazepines. Benzodiazepines have a lot of medical uses. They help reduce anxiety in surgical patients. They can be used to treat sleep disorders. They also help with the experience of muscle spasms and seizures. Valium and Klonopin specifically relieve excessive stimulation of the cerebral cortex, which is what's related to seizure disorders. And these, again, the Valium and Klonopin are the more long-acting benzodiazepines, so they're less addictive potential, and they would be appropriate for something like seizures, which you need the substance in your body for a longer time. IV diazepam is something that's administered intravenously, and this is really effective in terms of managing acute alcohol withdrawal symptoms. So if you'll remember from the alcohol chapter, alcohol withdrawal can get really, really intense and really dangerous very quickly. And it can lead to seizures, convulsions, and even death. And so diazepam is a way to activate the same neurotransmitters that alcohol does and prevent and manage those withdrawal symptoms without actually giving the patient alcohol. IV diazepam is also used to decrease agitation and aggression in psychiatric patients. So it can be used either IV or in an intramuscular injection in a shot format, and can be used to sedate someone who's causing problems in an inpatient facility. Rohypnol is a benzodiazepine I manage. You may be familiar with this as called roofies. And this is a benzo that's actually not approved for medical use in the United States. And your book talks about this a little bit in terms of the effects that Rohypnol has is very similar to Valium, but there's an important difference in terms of the potency, and also it's used it can be mixed in with liquids easier. It's colorless, odorless, and tasteless. And so given all of that information, why do you think that Rohypnol is not approved for medical use in the United States? You can also reference your book to help you answer that lecture question. Benzodiazepines are also used in psychiatric care. So I mentioned before that they have these anti-anxiety properties. They can help treat panic disorder, something more short-term acting like Xanax, or even longer acting like Klonopin. They can treat generalized anxiety disorder, also called GAD or GAD. They can treat like I said, severe agitation in patients who are experiencing psychotic episodes. They can treat muscle spasms. And again, just the general principle is the longer duration of action or half-life of the drug, the less addictive potential. And so for some of these psychiatric disorders, having a longer acting benzo is potentially less addictive than for the more acute disorders like panic disorder, where you give them something shorter acting. Also in sleep disorders, you're giving a patient a shorter acting benzo in order to help them sleep, which also bumps up the addictive potential whenever you're prescribing something that's more shorter acting. And that's it for the intro and medical uses of sedatives.